Hey mama, if you have a leaking pee when you sneeze, when you exercise, or suddenly feel like you have to run to the bathroom, you are definitely not alone. Bladder leakage is one of the most common pregnancy symptoms that I see as a pelvic floor physical therapist. But just because it's common doesn't mean it's something that you have to simply accept as your new normal. The good news is that there are strategies and exercises that can help improve bladder leakage in pregnancy. But before we talk about what to do, let's clear up some of the biggest misconceptions. Many women are told that if they're leaking, they just need to do more Kegels. But what if I told you that's actually the opposite of what many women need? For a lot of moms, the missing piece isn't more squeezing. It's actually learning how to relax and lengthen your pelvic floor, how to improve coordination of these muscles, and to help these muscles respond better to the demands and increased load of pregnancy. That's why all bladder leaks should not be treated the exact same way, and why the right approach can make such a difference. Hi, I'm Dr. Towne, pelvic floor physical therapist, prenatal and postpartum specialist, and mom of almost 4. My goal is to help you feel strong, supported, and confident throughout all of pregnancy and postpartum recovery. And before we jump in, if you are looking for pregnancy-safe workouts and pelvic floor guidance, make sure to subscribe and turn on notifications. All right, mamas, let's get into it. There are 2 common types of bladder leakage that we see in pregnancy. The first is called stress incontinence. This is when you leak pee with activities like sneezing, coughing, laughing, jumping, or running. During pregnancy, your pelvic floor is under a lot more demand. As your baby grows, you gain weight, your posture changes, and your pelvic floor muscles have to work much harder to support your body and to control your bladder. Sometimes these muscles simply get tired and they don't have enough strength and endurance to keep up. The second is called urgency incontinence. This is when you suddenly feel like you have to pee right now and you may leak before you make it to the bathroom in time. This type of leaking is often related to a pelvic floor that is holding a lot of tension and that isn't coordinating well. When those muscles stay tight and overactive, they can make your bladder feel fuller than it actually is, creating this intense sense of urgency. Another thing that can contribute to urgency is getting into the habit of peeing just in case. During pregnancy, this is really common to start going to the bathroom more frequently throughout the day or every time you wake up at night. But emptying your bladder before it is truly full can confuse your bladder signal, and it trains your bladder to go when it's not full. Emptying your bladder before it is truly full can confuse your bladder signals and train your bladder to feel full sooner than it actually is. That is why understanding your symptoms matters. The more you understand what is causing your leaking, the better you can choose exercises and strategies that support your body. This is exactly what we help you do inside the Strong Expecting Mama program. As we go through these exercises, remember that none of them should cause any pain or increase in your symptoms. Please stop or modify if you notice pain, pelvic pressure or heaviness, increased leaking, contractions, dizziness, difficulty breathing, or anything that simply doesn't feel right. The goal of these exercises is to help your pelvic floor learn how to contract and relax appropriately so it can better meet the demands of pregnancy and everyday life. Now, let's get started. We're gonna start with some pelvic floor lengthening and relaxation. So go ahead and go into a puppy pose. So you're gonna reach your arms forward and your knees are gonna be out nice and wide and your hips are gonna be lifted up towards the ceiling here. As we extend those hands forward, we're gonna feel a really good stretch into our spine and then down into our low back, into our sacrum, and into our tailbone. So as you inhale, I want you to think about breathing into your tailbone and down into your pelvic floor. So inhale through your nose and exhale through your mouth. So each breath, we're gonna think about expanding and lengthening those pelvic floor muscles that attach to your tailbone. Inhale through your nose. Lengthening that pelvic floor, exhaling through your mouth. You choose how deep you're getting into that position here and how low you are getting. You can always come up a little bit higher. You can also go on forearms. So choose a position that is comfortable for you. Inhale through your nose. Again, breathing, lengthening. Think about those bottom cheeks spreading apart from each other as you lengthen that pelvic floor. And then exhale through your mouth. Last one here, inhale through that nose. And exhale through that mouth. Everything in that low spine into that pelvic floor should feel relaxed and nice and lengthened. Grab a ball and a chair or an elevated surface to put your feet on. You're going to go ahead and lay down on your back here with your hips and knees at a 90-degree position. Ball between your knees. You're gonna do a really big inhale through your nose. As you exhale, go into a posterior pelvic tilt. So lift the tip of your tush up off of the mat. As you exhale, I want you to squeeze that ball gently between those knees, activating your inner thighs and lifting your pelvic floor up. So inhale through your nose. As you exhale, squeeze that ball, lift that pelvic floor, and hold. If you need to inhale and relax pelvis completely, you can. Exhale. Again, pelvic tilt, knee squeeze, pelvic floor lift, hold, and then slowly relax. So as you relax, I want you inhaling. As you contract, I want you to think about exhaling. Again, gentle activation of inner thighs and that pelvic floor lift. Inhale through your nose. Exhale through your mouth. Inhale through your nose. Exhale through your mouth. And then slowly relax. Grab a ball and put it in between your knees here. We're gonna sit our tush back to our heels here, lengthening our glutes. And then as we exhale, we're going to lift through our glutes, lift our pelvic floor, and contract our abdominal muscles. Okay, lots to do here. So inhale, relax. Breathe into 360 degrees, so rib cage, side and back, and then exhale, contract and lift. So we're lifting from pubic bone up, we're contracting deep core. Inhale, come down, exhale, squeeze and lift. You're thinking about gently squeezing that ball too. That will help you activate that pelvic floor. Inhale down. Try and lengthen through the glutes. Exhale, squeeze and lift. Inhale down, exhale up. Contracting those glutes, contracting that pelvic floor and that core. Couple more here. Last one, you got it. Really lengthening through the glutes as you inhale, stretch. Exhaling, squeeze ball, lift pelvic floor. contract deep core. Nice work. Go ahead and find an elevated surface that you can rest your shoulders, head, and neck on, and then grab a small ball to squeeze between your knees. We're gonna inhale as we're resting our bottom down on the mat. Exhale as we push our heels, squeeze our glutes, and lift our pelvis up off of the mat. So we're contracting pelvic floor, contracting core as we lift up. Inhale down, exhale up. Squeezing ball gently, lifting pelvic floor, contracting core. Inhale down, exhale up. Lift those hips up as far as you feel comfortable here. Make sure you are resetting each time, so lower those hips down. Find length through the glutes, length through the pelvic floor before you contract on exhale and lift those hips up. So you can always modify that range of motion, make it a smaller lift here, that's okay. And you can also always take that ball out as well. Inhale through that nose, exhale through mouth. Contract pelvic floor up, contract that deep core. You can do this, one more. Inhale through your nose, exhale, lift. Squeeze that ball, lift those hips up, really strong throughout that entire core and pelvic floor. And slowly come on down. Grab your small ball and put it in between your knees here. And we're going to put our hands right underneath our shoulders and our knees right underneath our hips. We're gonna do a big inhale, breathing into your back, into your side rib cage. As you exhale, think about lifting baby away from the floor, up towards your spine, and exhaling as much as you can. So inhaling, dropping baby belly, exhaling, lifting belly up. At the same time as you lift belly up, I want you to gently squeeze that ball and engage that pelvic floor. So inhale through your nose, relax belly, relax pelvic floor. Exhale, contract belly, contract pelvic floor. If you want to make this more challenging, we're going to go ahead and lift those knees off. So inhale through your nose, relax belly, exhale through your mouth, contracting core, lifting knees off just a little bit off the mat, and then slowly coming back down. Inhale through your nose, relaxing everything, exhaling. Contract core, contract pelvic floor, lift off, holding that ball, and then slowly come back down. Nice and slow, under control. Just two more like that. Inhale through your nose. Again, you have options. You do not have to lift those knees up, but you can always keep them down, contracting core and pelvic floor. Last one here. Inhale through your nose, exhaling. Contract core, lift pelvic floor, lift knees off, hold, and then slowly lower down. I hope this video helped you understand that while bladder leakage during pregnancy is common, it's not something that you have to simply accept as normal. In fact, women who experience bladder leakage during pregnancy are more likely to continue having symptoms in postpartum. This is exactly why addressing them now can make a big difference. And if you want more guidance like this, that's exactly what we help you with inside the Strong Expecting Mama program. It is our pelvic floor PT design program built around the same pregnancy exercises that I teach my patients and that I do for my own body. These workouts are designed to support your pelvic floor during pregnancy, helping improve your symptoms like bladder leaking, pelvic heaviness, and optimize pelvic floor function for labor and delivery, and set you up for a smoother and stronger postpartum recovery. Click the link below to start your free 3-day trial and see if it feels like the right fit for you. Once you get started, use code YouTube10 for 10% off your monthly subscription. And if this video was helpful, make sure to like and subscribe and turn on notifications for more pregnancy-safe workouts and pelvic floor education. Don't forget to send this video to another mama who's been dealing with bladder leaks during pregnancy, because the right exercises and education can go a long way in helping you feel stronger and more confident throughout all of pregnancy. See you in the next video.